Hello, good morning, dear students. Today is our next class. Okay, what were we talking about? We were talking about the normal radiographic anatomy, right? So, in the last class, we have spent quite a lot of time in understanding the basics, right? So, now I will be not explaining it in detail because we've already done that. Now, I'll be talking what all we are going to see in the maxilla and the mandible. Okay, already we know radiolucent, radiopaque, everything. It will not be repeated again and again. Okay, so let's start the main topic now. I'll be sharing the screen, just a second. Yeah. Okay, can you see the screen? Yes, okay. Okay, so what are we talking about? We are talking about the maxilla. You can see the maxilla over here. This is the maxilla, the specimen of a maxilla from the anterior region. And over here in the second photo down there, you can see when you're seeing from the palate. Okay, so we're going to see the arch and the palate. Okay, just a rough introduction I'll give over here. What are we talking about? We'll see the intermaxillary suture, the anterior nasal spine, the nasal fossa, incisor foramen, superior foramina of the nasopalatine canal, the lateral fossa or the nose, nasolacrimal canal, maxillary sinus, zygomatic process and the zygomatic bone. Okay, these two are different. Please pay attention. The nasolabial fold and the pterygoid plates. Okay. Now all this will be seen whenever we're taking a radiograph of your first from incisors to your molars. Okay, but which one will be seen in which radiograph, that is specific, which you need to know. Let us start. Okay, first of all, the intermaxillary suture, which is also known as the median palatal suture. Do you remember your anatomy here? Intermaxillary suture. The name is self-explanatory. It is the suture intermaxillary. It is the suture between the two maxillary bones, right? So that is the intermaxillary suture. Now, just close your eyes for a second. Imagine two bones joining. Okay, right? Now, this is bone. This is bone. Okay, so this will be white on the structure. Okay, radiopaque. This will be white again on the X-ray. In between, can you see a line here? If I consider these two as maxilla, can you see a line between here? Can you see a gap there? Yeah. So that gap will let some X-rays pass through it, yes? Common sense. So now those X-rays are going to pass through this gap here and they're going to expose the film. So finally in the film, how are you going to see the intermaxillary suture? It will be a black line because the X-rays are crossed, they have hit the film and exposed it, right? Intermaxillary suture is a radiolucent line in the midline of the maxilla from the alveolar crest between the central incisors superiorly through the anterior nasal spine. It continues posteriorly to the maxillary palatine processes till the posterior aspect of the hard palate. So we are saying that it is a line from here till the anterior nasal spine it is running, okay? And when you're talking posteriorly, it will go till the hard palate. Clear? Now, this is limited by two radio-opaque borders of thin cortical bone in each maxilla. Okay, it is limited by two radio-opaque borders of thin cortical bone. Let me just bring out my pen. Okay, let's just try the spotlight. Yeah, can you see this part here? Can you see this black line? So this is your radiolucent line, which is your intermaxillary suture. Now, can you see one white line here and one white line here? 1 second. Can you see two white lines? Where are we going? I'm really sorry for that. Let me just close this, bring it back. Okay. Yeah. One black line, one white line, one white line. So what is this? Again, it is the maxilla, the bone has started. So the bone के दोनों side we are seen as white. So that is it. That is how we are explaining it. It is limited by two radiopaque borders of thin cortical bone in each maxilla. A small rounded or V-shaped enlargement, which is radiolucent, is seen at the alveolar crest. We can see an enlargement at the alveolar crest, which is over here. Okay. Next slide. Okay, the anterior nasal spine. Okay, when we look at our maxilla over here, just at the border of the nasal fossa, we can see two extensions, one from the right maxilla and one from the left maxilla. They go up and then meet and they form the anterior nasal spine. Okay. On the periapical film of the maxillary central incisors, it is seen in the midline about 1.5 to 2 centimeters above the alveolar crest at or below the junction of the inferior end of the nasal septum and the inferior outline of the nasal fossa. Okay, so if I'm going to ask you, where do you see your anterior nasal spine? So it is in the midline. First of all, it is in the midline. Okay, then you will tell the distance. 1.5 to 2 centimeters, that is 1.5 to 2 centimeters above the alveolar crest, and at or below the junction of the inferior end of the nasal septum. Nasal septum के inferior end पर है या फिर the inferior outline of the nasal fossa. Okay, so midline to 1.5 to 2 centimeters. It's either below the junction of the septum or and at the inferior outline of the nasal fossa, and it is a V-shaped radio opacity. Again, we come to the same thing. Why is it radio opaque? See, why I'm emphasizing this again and again and again. It may seem very boring to you right now, but what happens is when in the exams you're asked, okay, what is the anterior nasal spine? So it is sitting there blank. Why does this happen? Because you have just learned that it is here, this is that. Okay. But now you don't know if it's black or white. You don't know why it's black or white. Okay. See, this is the basic thing. You have to know why it is black. You have to know why it is white. What did I tell you last time? What is it? It is an anterior nasal spine. It is a projection. Okay. Just close your eyes. Think. यहाँ पर आपके nose के end पे there is a projection. There is an outgrowth of bone. ठीक है. Already maxilla है. Then उस पे थोड़ी सी और bone उठ गई है. Okay. So if the X-rays are going to hit on some structure and pass, and they're going to hit on some extra structure and pass, which side will be whiter? जहाँ डबल चीजें रोक रही है वो वाला एरिया ज्यादा वाइट दिखेगा हमें, राइट? एंड जहाँ सिंगल चीज रोक रही है वो वाला एरिया हमें कैसा दिखेगा? इट विल लुक लिटिल डार्कर. ओके, रिमेंबर रिमेंबर रिमेंबर, the thing which will stop more of the X-rays will look white, the thing which will let the X-rays pass will look black. Okay, so now what was it then? The anterior nasal spine, it is white. White means radio opaque. Okay, got it? No confusion. RO, radio opaque, white. It is a bone, extra bone, going to stop the X-rays. And where are we going to see it? We are going to see this projection. Can you see over here? Whenever we take an X-ray of the anteriors, okay, between the two incisors, if I tell you take of 1-1, if I ask you to take X-ray of 1-1, in this X-ray, you up in the upper region over here, where you see the arrow, you will see a V-shaped radio opacity. It's like V. Okay, so that is the anterior nasal spine. We'll come to the next, the nasal fossa. Before you start reading my slides, just think, what are we talking about? Nasal fossa. What is fossa? Fossa is any depression. Okay, nasal is nose. Nose के पास जो depression है, that is nasal fossa. कौन सा depression हमारे यहाँ पे? Remember your maxilla? Maxilla आपको याद है? First diagram. There's a hollow cavity here as a triangular. That is a nasal fossa. ठीक है? Again, thinking in terms of radiology, उस nasal fossa अब मैं एक X-ray beam अपने ऊपर डालूंगी, तो मुझे X-ray पे कैसा दिखेगा? I will see a white and then beach mein I will see a black triangle. That is the nasal fossa. Same thing over here because I'm taking a periapical radiograph. तो यहाँ पर आपको एकदम ब्लैक एंड एकदम व्हाइट नहीं दिखेगा. वी आर टॉकिंग टर्म्स ऑफ शेड्स ऑफ ब्लैक एंड व्हाइट एंड ब्लैक का या फिर ग्रेनेस. ओके, तो यहाँ पर आपको नेजल फोसा के ये दो लाइंस, ये these are the border of the nasal fossa. Can you see? So the anterior nasal spine, these are the border of the nasal fossa, and above that you will see this is the nasal septum continued, and over here are the two sides nasal fossa. Got it? So it's a radiolucent image on the intraoral radiograph of a maxillary teeth. The inferior border appears as a radio-opaque line extending bilaterally away from the base of the anterior nasal spine. Again, we're going to just close our eyes and think. What did we talk about here? हम उसके border define करने की कोशिश कर रहे हैं, okay? कि nasal cavity उसका border कहाँ है, okay? Instead of just mugging what is written here, the inferior border, it's not like that. Just close your eyes, think. We have a triangular black center nose, okay? It will be lined by bone over here, okay? So the inferior border of the nasal fossa appears as a radio-opaque line extending bilaterally away from the base of the anterior nasal spine. So it is a radio-opaque line extending bilaterally from the base of the anterior nasal spine. Did you get this? Easy, no? See, once you start understanding what we're talking about, you don't need to read this ever again in your life. Okay. Again, now we'll come to nasal septum. We're still talking about the same thing. I'll bring out my pen over here just to, in case you people are missing out something. Okay, to put my drawing tool, yeah. So this was your nose, yeah, your nasal fossa. This is your nasal septum. This is your anterior nasal spine. Okay, this is all we've talked about till now. What else have we talked about? Yeah, that's all we've talked about. Okay, so here we're talking about the nasal septum, which is this. Obviously, this is your cartilage. This is your septum. ये कैसे दिखेगा? हमें एक पूरा यहाँ पर ट्रायंगुलर ब्लैक दिख रहा है, यहाँ पे कार्टिलेज एक्स्ट्रा आ गया, कुछ भी चीज एक्स्ट्रा आई है किसी चीज पे. हाउ इज गोइंग टू लुक? व्हाइट. इजी? गॉट इट? So it's a radio-opaque. Why it is radio-opaque? Radio-opaque image arising in the midline from the anterior nasal spine. It is a superimposition of the septal cartilage and the vomer bone. Okay, the vomer bone is behind. It is a superimposition of the septal cartilage and the vomer bone. Right? This is the nasal septum. Then the inferior nasal concha. Okay, what are nasal conchae? These are these extensions over there in the nose. You remember, like this. Okay. Again, anything extra that we are seeing in the nose, how will that appear? How will it appear? It will appear as white, radio-opaque, right? So we can not see this because we are taking an IOPA. So IOPA will be limited till max here, unless you go so wrong that you take an X-ray here. You're not taking an X-ray of your nose, right? So in this IOPA, like just till here, we are not going to see the superior and the middle nasal concha. There are three types, you know, superior. The superior is the middle and the inferior. So when we're taking an IOPA max, if I take an IOPA like this, so my, okay, even my roots won't come till here. Yeah, it will just come till here maximum. Okay, so we will be able to see this. Next, back to my mouse. Yeah, just a second, give me a minute. Yes, sorry for that, some technical error. Yes. What are we talking about next after the inferior nasal concha? The incisive foramen. Okay. First, we just read this, then I will explain. Okay. If you want, you can just look at this black thing between the two central incisors. Can you see a black thing? Okay. Keep that black thing in mind. Let's read. Incisive foramen or the nasopalatine or anterior palatine foramen. It is a radiolucent image between the roots of the central incisors. The oral terminus of the nasopalatine canal transmits the nasopalatine vessels and the nerves approximately at the junction of the median palatine and the incisive sutures. Okay. So it is basically the nasopalatine foramen. Nasopalatine foramen में से हमारे जो incisive it transmits the nasopalatine vessels and the nerve. Touch your tongue at the behind your the roots of your central incisor, and you see that where you have the incisive papillae, you know, that is the incisive foramen. Wahin pe. Okay, this transmits the nasopalatine canal, or it's also called the nasopalatine foramen. Again, just close your eyes once. What was it? Black. Okay, why was it black? It is a foramen. Okay, normal bone है हमारे पास, एक जगह पे गड्ढा है. Okay, there is a hole at one place. Okay, X-rays will pass more through the hole or through the normal bone, through the hole or through the normal bone, one or two. Through the hole, obviously, because वहाँ पे density कम है, bone कम है, X-rays will pass more. So how it's going to appear over here? Radiolucent, flat. Got it? This is how you're supposed to learn it. Just use your common sense. Extra bone means white, less bone means black. Done. Okay. Now, what is an incisive canal cyst? I just put it here for just like that. Okay, it's an enlargement of the foramen and a canal. If it appears very enlarged, then it's a canal cyst. Not needed for you, but anyways. And what is the shape of this? It is a pear shaped. Okay, it's not mentioned here. It is a inverted pear shaped. One second. Okay. That is how you describe the radiolucency. Okay. Now we will go to the next slide. Yeah. Superior foramina of the nasopalatine canal. Okay. Look over here. This is an occlusal radiograph. Okay, we're talking about IOPs here, but this is put because it is not very clear in an IOPA. When we are talking about the superior foramina of the nasopalatine canal, we are going to see it easily in an occlusal maxillary occlusal radiograph, cross-sectional, right? Can you see these two holes on both sides of the intermaxillary suture? Okay, over here also you can see something like, can you see a radiolucency two sides over here? Okay, but it does not come very clear. So you can just mention, but mostly if you want to see something, it will be seen in the occlusal radiograph. So these are two radiolucent areas above the apices of the central incisors in the nasal cavity floor on both sides of the septum, that is round or ovoid shape. Okay, there are both sides of the septum, either they can be round or ovoid. And where are they seen? They're seen above the apex of the central incisors. Easy? Okay. Now, the lateral fossa. Okay. It is also known as the incisive fossa, a gentle depression in the maxilla near the apex of the lateral incisor. Okay. It is at the apex of the lateral incisor and is diffusely radiolucent. Okay, this is this area. It's the lateral fossa here. the nose ka jo side wala part. Okay, and there's a depression, so that is called like that. It is radiolucent. Why we need to know this again? Because if I give you a radiograph of your lateral incisor and between your canine and lateral incisor, and I tell you to see and ask you, what is this radiolucency here? Do you think it's something abnormality? And you will look at it and like, yes, ma'am, it's an abnormality, right? How? Obviously, any radiolucent lesion that we will see at the apex of any tooth, we will say that it is either a cyst or it is some abscess or some infection, right? Or pedial widening or anything. That is our first reaction. That, oh, ma'am, kuch to gadbad hai isme, right? But that is where this is important. The lateral fossa is a radiolucency, okay, between your near the apex of the lateral incisor. Okay, over here it's a radial. You touch and feel it. Okay, there's a small depression there. So that is why we need to know that this area may you would see something. That does not mean that the tooth is infected and you just pull it out or you do an RCT for it. That it is a normal finding. It will be seen in every person. So it is a landmark. That okay. Now the nose. Where is the nose here? What is it made of? We have talked about everything till now. Bony. अब हम बात कर रहे हैं. We're talking about this soft tissue thing. Okay, cartilage, soft tissue, whatever this is above this. It is a superimposed on the anterior maxilla, right? And it is a slightly opaque appearance with a sharp border. Okay. When we're taking a X-ray of your maxillary central incisor, what is the angulation that we're giving? We're giving a plus 40. Okay, so we're going to take our X-ray cone. Okay, I'll just put my head like this for a second. Okay, so that you understand. Obviously, I'll get my chashma removed before I take the X-ray. So I'll do that also. I'll take my cone, PID, position it here, make the person look down, place a film, and I will shoot at plus 40, right? So now what is the angle? What is when I get this on my, when I see that my teeth on the radiograph, this X-ray is also penetrating through my nose, and some X-rays are penetrating directly above my lips. So the X-rays which are going through my nose, how is that going to appear? Again, answer in terms of extra or less. Does those X-rays have any extra structure to pass through or any less structure to pass through? Extra, right? It's a nose, extra nose which mein aa gaya hai. So the X-ray will pass through that. So how is it going to appear? Any extra structure X-rays pass through will appear white, right? So now just look at it. Can you see an outline of a nose like this? Can you see it? Yeah. So bending the head, positioning the PID, and we're getting the teeth and teeth ke around the middle and the apical region pe you are getting your around इस तरह से with a sharp border. So this is your nose. No confusion? Okay. Chalo, great. Now, okay. How much time do we have? Okay. Just give me a second. Okay. I think some technical issue over here. I'll just end this meeting. Please rejoin. Yeah. Okay.